Hi, Dr. Paul here. I want to talk about the subject of depression. Very misunderstood. Some people think it's just being sad here and there. We're all sad here and there. We all have stress in our lives here and there. There's a difference between stress here and there and an anxiety disorder, which is more pervasive and persistent. And there's a difference between sad here and there and having major depressive disorder, or a minor depressive disorder, or a condition we call dysthymia, though dysthymia is more of a minor depression that's more persistent. But basically, the symptoms are typically frequent sadness. The most sensitive symptom would be depressed mood, and also what we call anhedonia, which means lack of interest in things that you used to like to do. Whatever you like to do, whatever it is, if you lose interest and it just becomes, you just have no interest, that's a very sensitive sign of depression. Fatigue, poor motivation, poor energy, sleeplessness at times, which also we see with anxiety, and also suicidal thoughts. And that's another thing, that when people feel sad and depressed for a long period of time, some people feel like that things are hopeless, and they're feeling helpless, and they're feeling that there's no answer out there, and they're feeling that what's the point of going on anymore if this is all I have in life is to feel like this. But the important thing to remember is there is an answer. There's a way of getting out of this. You don't have to suffer with this. You didn't ask for this. It's not your fault that you have this. It's not anybody's fault that they have anxiety or depression or bipolar disorder. Whatever I see, people feel guilty about it, or they feel shame about it, which because of the fact that they think it's something that they brought on themselves. It's not. It's something that you can help. It's typically genetic. It typically happens because of trauma or other reasons. And, and what's the answer? Well, sometimes therapy can help for people. Exercise can help, which exercise can help with anxiety, with depression, with a lot of things. But again, a lot of people will tell me, I just don't have the energy. I just don't want to exercise. That's very common. And so this is where the medical treatment comes in. This is where medications come in to get people out of this state. And the medications are balancing their neurochemistry properly in order to get them feeling like they used to feel. And the goal of treatment, we call remission, means getting people back to their old self again, when they used to feel good. So when someone tells me, this is me, I haven't felt like this for a long time, or this is the old me. And some people tell me, frankly, I don't think I've ever felt this good, to tell the truth. I didn't even know that you could feel this way. I love hearing that, because that means this is a person who's been suffering their whole life with something that we're finally treating. And this causes a whole new lease on life, and people can now look forward to living and have hope now. And when you feel hopeless, there's nothing better than having hope. And when I see a person who comes in my office severely depressed, and when I spend my first hour with them, and they leave the office with a smile and they say, I finally have hope. This happened already this week a few times from the new patients I saw this week, and I love hearing that, because now I told them, look, keep in touch with me closely, call me next week. I like to keep very close contact with my patients, because I want to get them out of this quickly and not wait around. And so if you have any question about this, you can always get a hold of me. If you're suffering with depression and you can't find the help, contact me. I can help you. Thanks for listening.